Now, today we will be dealing with some of the important topics in pathology, in medicine, in surgery, and dermatology. There have been a lot many questions based on eponyms, and they are very relevant as far as our examinations are concerned. There are a lot many terms concerning fruits, vegetables of clinical significance, and today we will be discussing those in details. Now, we will not be discussing only about these points as well, but once I go through my class, there are certain other points which might be asked from you in the examinations. So it is very important that you remember all these points. They happen to be high yield points. There's a lot of concentration in the topics involved, and once I go through some of the things, these things happen to be very important. So my stress will be on the points which are very important from an examination viewpoint. The first of the eponyms which has been asked many a times is something concerning potatoes. Now, as far as potatoes are concerned, you remember that there is a term in medical terminology which we give the name as potato nodes. There is this one clinical condition which is a granulomatous infection, and that is given the name as sarcoidosis. Sarcoidosis happens to be a very important pulmonary condition, as important as tuberculosis, and there are a lot many questions which are asked from sarcoidosis. So this sarcoidosis basically is a disease which affects multiple organs, and it happens to be a systemic disease. And we are here talking about the pulmonary manifestations of sarcoidosis. So as far as sarcoidosis are concerned, the lungs are very important, and the respiratory system is involved most frequently. And what is this sarcoidosis about? Now, in the sarcoidosis, we have granulomas, and granulomas have a mixture of cells. There are multiple types of cells, the Langerhans cells and the foreign body giant cells, in addition to the clustering of the lymphocytes, CD plus 4 lymphocytes. Now, what is specific is that there are those granulomas, and this characteristic type of granulomas which are present in sarcoidosis are non-caseating granulomas, and this is what distinguishes them from tuberculosis. And in sarcoidosis, there's a classical radiographic finding that there can be presence of, it is not, I did not mention that there always will be, there can be presence of bilateral hilar lymphadenopathy. So the hilar will be enlarged on the radiographs of the chest. Now, I would just make a mention of some of the important points here which have been asked from sarcoidosis, like what are Schaumann bodies, what are asteroid bodies, and what are residual bodies. So but for the timing, I will not go into the discrete details of these things, but you remember that a characteristic pathological feature of sarcoidosis is Schaumann bodies, asteroid bodies, and residual bodies. We will come to that once we take sarcoidosis in detail. But over here, remember that what we are concerned with potato nodes over here is the presence of bilateral hilar lymphadenopathy, and as is evident in the radiograph below. So over here, this is the radiograph of the chest, and in here you can see the clustering over here and this area. So there is bilateral hilar lymphadenopathy, and these nodes give the appearance of potatoes. So bilateral hilar lymphadenopathy in a case of non-caseating granulomas, a pulmonary condition sarcoidosis, is given the name as potato nodes. So this is very important, and it has been asked in radiology, it has been asked in medicine. Now, going ahead, surgery, and we have this term GAVE, which is given the name as gastric antrovascular ectasia. So it is one of the common causes of GI bleeding, and GI bleeding can present with iron deficiency anemia at a later stage once there is chronic bleeding. Now, what is this GAVE? It is also given the name as watermelon stomach. Why is it given the name as watermelon stomach? You can see. Let me take you the figure directly over here. So this is a watermelon, and you see striations over here running longitudinally in a similar manner in the mucosa of the stomach over here, over here, over here, over here, and over here. They give the same appearance as of a watermelon. So the GAVE, gastroantrovascular ectasia, represents basically dilated small blood vessels in the antrum So specific to the antrum usually, which is the last part of the stomach, because stomach has multiple parts, the fundus, the body, the pylorus, and the antrum. So over here, it is given the name as watermelon stomach. Why? Because of the presence of these streaky, long, red areas that are present in the stomach, and they give exact resemblance to the watermelon. So this is a figure you have to remember, and you will never forget game. Now moving ahead, in dermatology, well recognized, a very good dermatologist will always recognize sweet syndrome. What is sweet syndrome? It is a combination of facial rash, neutropenia, and cutaneous lesions. And this is given the name as acute febrile neutrophilic dermatosis. And herein, sweet, we're talking about something relevant to the fruits and the vegetable. So there is sweetness associated with it. So we'll not talk much about bitter things today. So it is something sweet. So acute febrile neutrophilic dermatosis, and it is characteristically present by the red to brown plaques. So you have to remember plaques and nodules, which may be reddish or brownish in color, and they are frequently painful. Pain is an important component of this important sweet syndrome, and predominantly present on what regions? Head, neck, and upper extremities. So this is very characteristic of sweet syndrome. Now, as I mentioned, fever, neutrophilia, and dense dermal infiltrate of neutrophils in the lesions. So characteristic of pathology is a high concentration of neutrophils in the lesions. Now, what is important about sweet syndrome is that it is usually associated with hematological malignancies, and one of the malignancies which is important is AML, acute myelogenous leukemia, in addition to some other hematological malignancies like the lymphoma, as well as other myelodysplastic syndromes, myeloma as well. So in elderly, you can have the association of myeloma along with sweet syndrome. Now, this is how a lesion of sweet syndrome would look like. Now, there is this fruit which is the strawberry, and many of us like strawberries, and strawberry is associated with many things. I would not go in detail about this thing, but you have to remember that these one-liners have been asked. So what is number one? Strawberry gallbladder. In gallbladder, sometimes there's an excessive accumulation of cholesterol, and that gives appearance to the gallbladder like a strawberry gallbladder. Number second is this important disease, which is a streptococcal infection, and that is given the name as scarlet fever, usually present in young, rare these days, and its appearance as far as the tongue is concerned, the tongue is red and beefy, and it is given the name as strawberry tongue. Now, the strawberry tongue is not restricted to only scarlet fever. There is another pediatric entity which is given the name as Kawasaki's disease, and Kawasaki's disease is also given the name as mucocutaneous lymph node syndrome. And in Kawasaki's disease, there are multiple features: desiccation of the skin, presence of coronary aneurysms, etc. But in here also, there is the typical appearance of the tongue similar to the appearance of scarlet fever, and that's why we give the appearance of the tongue as strawberry tongue and strawberry tongue, both in case of Kawasaki's disease as well as scarlet fever. Now, there is this sexually transmitted disease which is given the name as trichomoniasis and Trichomonas vaginalis, which is a flagellate protozoan. It causes trichomoniasis, and in here the cervix, which is, the cervix after hyperactivity gets inflamed, and it is given the name as strawberry cervix. Now, hemangiomas, there are these hemangiomas which are present at early stage at the birth, and there is this important type of hemangioma which is given the name as nevus vasculosus. And nevus vasculosus is a strawberry hemangioma, condition which is benign, not malignant, not to be much afraid about, but it resembles a strawberry. So there are certain things which resemble strawberry: the gallbladder, the tongue, the cervix, and we have the diseases just having approximation. And as you can see in the figure over here, this is the gallbladder, and this gallbladder has excessive accumulation of cholesterol, and this is the strawberry gallbladder. So over here, this is the strawberry gallbladder, well appreciated in the figure. Now, strawberry tongue. Over here, you can see the tongue, and just exactly these lesions, these resemble the strawberry. We have taken the strawberry, and you can see that these this tongue as a whole resembles a strawberry. So this is the strawberry tongue, classic of streptococcal scarlet fever and Kawasaki's disease. Now, many of us might be liking oranges as well. So oranges, you must be aware of this clinical condition, pudy orange. And what is this pudy orange? Pudy orange is basically the involvement of the lymphatics of the breast. And once there is a tumor infiltration into the lymphatics of the breast, it gives the appearance to the breast, which is a bit corrugated, which is a bit roughened. And that typical appearance is given the name as pudy orange appearance. Now, it happens to be a common feature of breast cancers, but more so of one important clinical type of breast cancer, which is the inflammatory carcinoma of the breast. And that's a bit more aggressive type of breast cancer. It usually causes more pudy orange appearance than other types of cancers. So just a brief preview. So this involves the dermal lymphatics and has caused a high incidence of systemic metastasis. So the prognosis in case of once we have a patient whose breast is being examined and the breast in itself shows pudy orange, that might indicate a stage of the breast cancer which is a bit advanced. So that has to be taken and might indicate poor prognosis in many cases. And this means the lymphatics have been blocked and the area of the skin has developed lymphedema and pudy orange appearance or orange peel appearance. So pudy orange appearance or orange peel appearance is characteristic of breast CA, especially what I just mentioned, the inflammatory breast CA. So what is this pudy orange appearance? So over here you can see, so this is the area of the orange which you see is a bit roughened up. So exactly in a similar manner, the surface of the breast would be having this thing, maybe with a retracted nipple, with a nipple discharge. So these are other, I'm not concerned about these features over here, but or axillary lymphadenopathy, but over here this is what the surface of the breast would look like. Now, onions, it pertains to vegetables and onion peel appearance. Now, sometimes what happens in orthopedic clinics, orthopedic oncology, and unfortunately, orthopedics will come across a young child, and the young child will be having pain, fever, and just something like an infective pathology. And this Ewing sarcoma is very important because it usually presents like osteomyelitis. And one important thing is to remember that this happens to be a bit of an aggressive tumor and it is a diaphyseal tumor. And what is this Ewing sarcoma and the association with the onions? Now, this, first of all, Ewing sarcoma, you have to remember that it's a type of bone tumor and it is usually present in children less than 15 years of age, unfortunately. And it is diaphyseal. You have to categorize tumors in orthopedics according to metaphysis or diaphysis or epiphysis. This is a diaphyseal tumor. And there is this onion skin lesions on the X-ray. And what is this onion skin lesion of the X-ray? I will not go to this figure first. I will go to this figure. Now you can see over here, this figure. This shows the concentric rings of periosteal tissue being laid. And this is what the tumor, there is a concentric ring over here. So this is the onion peel, which we say in case of Ewing sarcoma. So there's a concentric growth of or the concentric periosteal reaction. And this is what is given the name as onion peel appears. And how do you appreciate it on radiographs? Very difficult to pick up at the initial part of your career, but an expert orthopedist or a radiologist will pick up. So over here, this is the area wherein there is this Ewing sarcoma in a child, and once going through, we can just have a look at it and you can not here clearly see. But if we go through more details, we can have a look that there are this concentric periosteal reaction over here, and this is Ewing sarcoma. Now, Mulberry molars. Mulberries, you know, you're also aware of Mulberry because you study marula in embryology. And after that, why do the molars and the mulberries make an association with themselves? You remember this clinical condition which is given the name as syphilis. And syphilis has got many forms. One of the types of syphilis is congenital syphilis. And in congenital syphilis, remember this thing, I just mentioned it in the slide over here because there are so many questions about syphilis. Syphilis has got so many eponyms. It's a darling of eponyms, and you have to remember these things. Osteochondrites, periosteoids, bilateral hydroarthrosis involving the knees and palate joints, what we give the name as Clinton joints. So you have to remember this thing. Now, we are not concerned about that thing much over here, but in here you have to remember that there is a presence of Hutchinson's teeth and Mulberry molars. What we mean by Mulberry molars is that there's this cusp. In here, there are the cusps, and the cusps should be of a smooth margin. The cusps should be of a smooth margin, but over here the cusps are not smooth margin. There's small development of the cusps, and you can see over here there are these protrusions, and these protrusions are irregular and they are bumpy, so the cusps of the teeth are not developed well. And over here the molars may show multiple poorly developed cusps, and that is what is given the name as Mulberry molars. So this is a feature of syphilis, and you have to remember this thing. Now, cherry red or raspberry tumor, same name for two tumors, raspberry tumor or cherry red tumor. So over here it is one and the same things. Sometimes at the time of birth, a neonatologist can just experience swelling at the site of umbilicus, and that is given the name as umbilical adenoma. A benign condition, but you have to take care about it, and it exactly resembles a cherry. So that is why it is given the name as umbilical adenoma. And this, you have to remember that it is also given the name as, so the other name of umbilical adenoma is raspberry tumor or cherry red tumor, and it is benign and it is present at the time of birth. And a neonatologist or a pediatrician should not be just too much disturbed about this lesion up till and unless it requires an immediate surgical intervention. So this is a raspberry. Over here you see this scan, and it shows a cherry red tumor in the umbilicus. Now you are just aware of Cushing's disease, which is a condition associated with increased cortisol production. And what can happen, we have got a type of obesity. It is having many features, well, just like impaired glucose tolerance, hypertension, striae, easy bruisability, as well as osteoporosis, muscle wasting, and psychosis, as well as hirsutism. And there's this type of obesity in the form of central obesity. That means the abdomen is there, the trunk area is grossly enlarged, and there's a buffalo hump, but the peripheries tend to be just like sticks. So that is what is given the name as lemon on stick appearance, and that is characteristic of Cushing's disease. Just remember it, by the way, because it has been asked. Now, Vibrio cholera, rice water stools. Vibrio cholera is one important organism which was very important in the past, and it used to cause rapid progressively diarrhea, and that used to cause a lot of electrolyte imbalance, and a patient would just go into shock after cholera. And what is the characteristic feature? There happens to be diarrhea, and the nature of the stools happens to be rice water or pea soup. So rice water or pea soup diarrhea, it's a classical feature of Vibrio cholera, and this you have to remember that it's a notifiable disease nowadays. You do not have cholera in many of the regions, but once there's onset of cholera, you have to report it immediately to the authorities. That's important. You cannot forget the association of John Snow with the cholera, and he was known because of this disease, the father of public health. So you have to remember rice water stools or pea soup diarrhea associated with Vibrio cholera. Now, this is the characteristic feature of a diarrhea stool. I hope you won't have to have a look at this type of stool in your lifetime. That's it. Now, there are types of acne. There's one type of acne which is acne vulgaris, and second type is acne rosacea. And acne rosacea is sometimes complicated by presence of something which we give the name as potato nose. So acne rosacea. And what is acne rosacea? It's an inflammatory disorder affecting the central face, and it is present in adults. And what is the feature? Erythema, telangiectasia, superficial pustules. And what can happen there can be hypertrophy of the underlying connective tissue, and that can cause overgrowth of the underlying connective tissue, and especially of the nose area. And this is given the name as rhinophyma. So you have to remember that the analogous name for rhinophyma is potato nose. Remember the picture below, and you will not forget rhinophyma or potato nose. So over here you can see this does not look like a nose. It looks like a very heavy object, and this is the hypertrophied nose. So this area, you can see that the nose area is very into hypertrophy. So potato nose is synonymous with rhinophyma. You have to remember this thing. Now, what can happen in boxers, in wrestlers, in people involved in sports events, in rugby players, there can be sometimes a blow on the ear, the pinna of the ear, and there can be a collection of the blood within the, and it can cause a hematoma in the pinna. That hematoma in the pinna is given the name as cauliflower ear. So this is one of the important things, and later it can get infected, and there can be perichondritis as well. So this is something you have to remember about cauliflower ear or hematoma in the pinna. Over here, this figure you remember. So this is over here. You can see a enlarged, a bruised pinna over here and hypertrophied as well. Now, we come across berries, and unfortunately, some patients have got the typical aneurysms in their circle of Willis, and especially in the anterior circulation, which we give the name as Berry's aneurysms. And aneurysms are circular dilatations in the vessels, and sometimes, unfortunately, they can bleed and they can cause subarachnoid hemorrhage with blood in the ventricles of the brain. A very, 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 I mean to say, dangerous condition, which can just be fatal as far as life is concerned. So, Berry's aneurysms are circular dilatations present in the circle of Willis, unfortunately bleeding sometimes, presenting with a rapidly evolving hemorrhage with blood in the ventricles of the brain, and that is given the name as SAH, subarachnoid hemorrhage. So you remember berries and the association with adult polycystic kidney disease. There's a significant association which is asked sometimes in NEET DM, the association of adult polycystic kidney disease with certain condition, and Berry's aneurysms happen to be one condition while it is associated with this. So you can see over here, these are the vessel dilatations over here. These are the vessel dilatations over here, and this is the histopathological figure showing the microscopic view of a dilated vessel. But over here, this is the vessel dilated. This is the vessel dilated, the Berry's aneurysms. Now, in dermatology, dermatologists come across these human papilloma virus associated lesions, which we give the name as warts. So warts are roughly surfaced, sharply demarcated, round, firm nodules, and they may be ranging in color as far as color is concerned, gray, yellow, brown, grayish black, and they can be caused by HPV1, HPV2. HPV1 causes plantar and palmar warts on the palms and the plantar aspect of the foot, and the common warts are caused by HPV. So you have to remember the warts, and warts you remember by this figure, you will never forget. So you must have seen them. It's a common clinical condition, and you can see these are the warts. Important. Now, unfortunately, again, in a young age group, females may present with a type of a tumor which we give the name as sarcoma by botryoides. So what is important? The botryoides is the name given to the grapes, a bunch of grapes, and this sarcoma botryoides is one type of embryonal rhabdosarcomyoma, and it is a malignant condition. And here you can have this tumor coming out of the vagina or within the uterine cavity in the form of a bunch of grapes. And you have to remember that's why we give it the name as sarcoma botryoides, and it is because of the cluster of grape-like, and now you have grapes, you have a cluster of grapes hanging over here, and this is how the grapes like lesions would just be present within the uterine or the cervical cavity of a young female. So this is something about sarcoma botryoides. Now, these are very important facts. These are not just meant for any cosmetic or comedic purposes, but these are very important from an examination viewpoint. So I hope that you remember these terms. I have just mentioned other features of these terms as well, and I hope that they will aid you, and they might be asked in the examinations if you're fortunate enough, and they will be answered by you as a result of this lecture of mine. And I wish you good luck for your examinations. Thanks a lot.